To me, Ady is what we need more of in our country right now. I have a lot of respect for him, and I know a lot about his story, his testimony before Congress, his organizing. And for me, we have a problem in this country where we are not connected enough to each other to understand that we're all in this together, and that the suffering of some undermines the well-being of all. How are you?
Senator Booker, thank you so much for taking the time to do this today, and for being the first candidate to do one of these conversations with me.
You never forget your first.
I want to start this off with a quick summary of my story and my life the last couple of years.
Hey Carl, it's me, Dad. A year ago I was a healthy man. Today my muscles are turning into jello and my voice ain't what it used to be. All that matters to me is to make you proud of your old dad.
That's very beautiful.
So, first question, Senator, and it's a hard one, are you and Ms. Dawson going to have some brilliant and gorgeous babies too?
She and I now talk in FaceTime all the time, and that would be a dream. So I'm hoping that the path we're on leads there. But you can help a brother out and give her a call and let her know that she should keep that in consideration.
With pleasure.
All right.
Okay, so back to some easier questions.
Yeah.
I know that your father had Parkinson's disease, which is related to ALS, and that caring for him was very challenging for your mother. So let me just ask, what was that like for you?
You see your dad go from a strong person, and then you get to a point where you're taking your dad to the bathroom, and where he is a man of great humor and great strength, and you see this disease that attacks him every day and tries to rob him of what makes him special.
Senator Booker, let's zoom out. Clearly, the healthcare system isn't working for the American people. Families are turning to GoFundMe, going bankrupt, and going without the care they need. On our healthcare tour last year, I met Raven, a student here in California with type 1 diabetes who pays $3,000 per month for the insulin she needs to survive. In Des Moines, Iowa, we spoke with Laurel, who was forced to move her family out of the state for 18 months after she had an aneurysm. She feared losing her health insurance coverage for the rest of her life thanks to that pre-existing condition, and the system features tremendous racial inequities, leaving black and brown families with worse care and worse health. As president, will you push to expeditiously replace the private health insurance model with a single-payer model, or will you push for a more limited expansion?
I think that if you ask anybody, and they're going to be intellectually honest with you, that if we were designing the perfect system in America, it would be a single-payer system. But this is where I want to be candid. I'm not going to let perfect be the enemy of the good at a time that we need serious good. As a guy who represented a low-income black and brown community, folks on my block didn't have time to wait for me to fight for the perfect criminal justice reform bill.
But why is moving quickly incompatible with pursuing Medicare for all?
I don't think they are incompatible, and I don't think we can afford to let them be incompatible. And so I deal and have for most of my career in a level of urgencies where the tyranny of the or is either this or that. I don't have time for that. Every single day we've got to move the system and make it better and create the kind of momentum and change in terms of our political spectrum to be able to move it.
I guess let me rephrase. Will you be asking Congress to send you a single-payer bill or a public option bill?
So the short answer is yes, but what if Congress doesn't? Presidents are, I think, at their best when they don't wait on Congress, but they also, like FDR did in creating programs that now we take for granted, like Social Security and more. Presidents have to be able to sell things, have to be able to move the bar, have to be able to make change happen. We can prove that we are on the right side of history by creating a public option that works, that has everybody from small businesses and entrepreneurs to folks like those that are in my community that can easily shift into that public option.
I agree with you that the healthcare crisis is dire. People need help right away. But that's actually how I arrive at my support for Medicare for all. The insurance industry is going to do everything it can to block any of these proposals, including a public option, which means the only way to win is with a huge grassroots movement.
Yes.
And that enthusiasm mainly exists for Medicare for all. I'm worried that people aren't gonna march or engage in civil disobedience in support of a public option. What do you say to that argument?
I say to folks that I agree with you. Change doesn't come from Washington, it comes to Washington. We didn't get women's right to vote because a bunch of male senators got together and put their arms around each other and said, hey fellas, it's time to get women the right to vote. We got that fundamental American right because people fought, demonstrated, demanded it, and it happened. This issue of healthcare for me, I see it every single day, how people are dying. Let's not use euphemisms. And so this is a moral issue. I really believe we need, especially after this president who is every day engaging in moral vandalism, the next president is not going to just have to be a great policy tactician. They're going to have to be a president that can best heal this country, call to our moral imagination, and call us to more collective action to achieve what should be fundamentally just.
Senator, I know you'll forgive me if some of my questions seem blunt, but this topic is life and death for me. I'm not sure I'll ever get to interview you again, so I'm just going to speak my mind. You would never take money from the NRA and the gun manufacturers, for example, and you're a national leader in the fight against gun violence. The pharmaceutical and insurance industries profit off of denying people necessary care, resulting in tens of thousands of preventable deaths year after year. Why do you think it's okay to take their money?
I actually don't think it's okay to take their money. Years before I got into this presidential primary, I said, you know what, I'm not taking corporate PAC money, I'm not taking federal lobbyist money. I decided before I became a presidential candidate that you can't campaign wrong and think you're going to govern right.
Okay. I asked people on Twitter what questions they would have for you about your healthcare plans if they got the opportunity to meet you. Sarah asks, what is your plan to improve access to mental health care and substance abuse treatment, particularly in the context of the opioid crisis?
Those of us in inner cities have been screaming about this awful policy we have in this country for decades before the opioid epidemic swept through lots of different countries, all over our country in all different communities. And so for those of us who've been watching this nightmare, I'm so happy that more voices are growing that say we can't arrest our way out of an addiction problem. We can't arrest our way out of a mental health problem. And treating addiction as a healthcare issue and substance abuse as a healthcare issue, not a criminal justice issue.
Senator, this is my last question. I am really grateful for your sitting with me and what you have laid out today. One thing I've been doing a lot of lately since my diagnosis is thinking about my life and legacy. I hope that Carl, Rachel, and other people in my life remember me as a committed husband, father, and as someone who spent his life trying to serve the public interest. I think being forced to confront my own mortality has made me think about that in really stark terms. I'm curious, what do you want your legacy to be after you eventually exit the stage of national politics? How do you want to be remembered?
The way you frame your question, first of all, it's very beautiful about your life. And I just want to say thank you to you because, again, the heroes in my life are not normally the people with titles or positions. The people who make transformative change are often folks in humble positions who find a way to trigger a deeper empathy that actually ultimately results in deeper understanding. We still bathe in the love of folks who died a long time ago who changed this nation, who changed this world. I feel like my days are limited as well. If I live as long as my dad did, I just have 10,000 plus days left on this planet. And I'm imperfect and I stumble and I come up short all the time, but I want to use every day I have to be the most bold and unapologetic instrument of love as I can in this world. And what does love look like in public? As one famous person once said, it looks like justice. And so I'm going to do everything I can, no matter what my title is, what my position is, no matter what, to just try to be an agent of love and not forget that often the biggest thing you can do in any day is often just one small act of kindness and decency and love to another.
Thank you, Senator. Your message and vision is one that the American people need to hear.
Thank you very much for giving me this opportunity to talk with you.